What causes autism in children? Scientists don't know the exact cause of autism spectrum disorder in children, but they believe it's caused by a combination of genetic and environmental factors. Some factors may increase the risk of ASD include genetic factors, having certain genetic conditions such as fragile X chromosome, fragile X syndrome, Down syndrome, or tuberous sclerosis. Studies have found rare gene mutations and common genetic variations in people with ASD. And some genetics, I can't do this. Oh, I can't do this. Trigger. Okay, let me start over. Scientists don't know the exact cause of autism spectrum disorder in children, but they believe it's caused by a combination of genetic and environmental factors. And the factors are genetic factors, having certain genetic conditions such as Fragile X syndrome, Down syndrome, or tuberous sclerosis. Studies have found rare gene mutations and common genetic variations in people with ASD. And some genes may affect brain development or communications. Some genetic mutations may be inherited, which with others may occur spontaneously. The next one is environmental factors. Let's say a woman exposure to harmful contaminations during pregnancy may trigger a genetic mutation that leads to autism in her child. Other environmental factors that researchers are exploring include viral infections, medications, air, pollut- air pollutants, and altered fluid channels in the brain. Then they got other factors. Having a sibling with ASD, being born to older parents, experiencing complications at birth, or having a very low birth weight may also increase the risk of ASD. Symptoms of ASD can appear as early as 12 to 18 months of age. and include difficulty with social communication, repetitive behaviors, restricted interests, tantrums, worries, and trouble focusing. Autism spectrum disorder symptoms. Causes they really don't know what the cause of autism is. But some says can be inherited. Are no links between vaccines and autism spectrum disorder. There are no links between vaccines. Risk factors. Autism spectrum disorder affects children of all races and nationalities, but certain factors increase a child's risk. These may include your child's sex. Boys are about 4 times more likely to develop autism spectrum disorder than girls are. Family history. Families who have one child with autism spectrum disorder have have an increased risk of having another child with the disorder. It also not uncommon for parents or relatives of a child with autism spectrum disorder to have minor problems with social or communication skills themselves or to engage in certain behaviors typical of the disorder. Other disorders. Children with certain medical conditions have a higher than normal risk of autism or autism like symptoms. Examples include Fragile X syndrome, an inherited disorder that causes intellectual problems. Sclerosis, a condition in which benign tumors develop in the brain. And Rett syndrome, a genetic condition occurring almost exclusively in girls, which causes slowing of head growth, intellectual disabilities, and loss of purposeful hand use. Ooh, okay. Extremely preterm babies, babies born before 26 weeks of gestation may have a greater risk of autism spectrum disorder. Wow. Parents' ages. There may be a connection between children born to older parents and autism, but more research is necessary to establish this link. Complications. Problems with social interaction, communication, and behavior can lead to problems in school, and with successful learning, employment problems, inability to live independently, social isolation, stress within the family, victim, victimization, and being bullied. Well, it's a lot. There's no way to prevent autism, but there are treatment options. Early diagnosis and intervention is most helpful and can improve behavior skills and language development. However, intervention is helpful at any age, though children usually don't outgrow autism spectrum disorder symptoms. They may learn to function well. I used to take care of a autistic child. I would have to pick him up from school at a certain time, and he was in a special class. I would pick him up from school, would go back home. I would fix his lunch. He would always eat garlic bread and fish sticks and drop in a Hawaiian punch. Every day he would eat. He would come home, do his, he didn't have homework, but he would come home. I would fix him fish sticks and garlic bread every day. And they would always tell me to put Miralax in his tropical punch. And I would do that every day. Every day. It was a everyday thing. Every day. I don't know why I can't talk, but it's hard to talk. I think there's medicine kicking in. It gotta be. I just came on here to do this little content. I'm finna log off once again because my voice getting, I don't know what's wrong with me. Why high? I think so because I can't talk. But I hope y'all enjoyed this little content that I had for autism. What causes autism in children, which they really don't know what's the cause. Could be inherited. Never know. If you avoid childhood vaccination, okay. Well, with that being said, I'm about to log off, log out, and stream. Please like, share, and subscribe to my channel if you like the content that I provide. Thank you. Goodbye.